Native women have always been the strengths of our communities. Montana is home to 12 tribal nations. As Native communities, we all have diverse histories, creation stories, cultures, and languages. We also share areas of common ground. These strengths include courage, generosity, and wisdom.
As Native people, we share how much we value our families. As Natives, we are brought up to care for each other, for our families, for our communities, and for our children. Our children are the most important part of our lives. We work every day to help provide for our families, educate our children, protect our elders, protect our youth, and to promote healthy and happy communities.
As Native women, we sometimes forget to take care of ourselves and our own health. Sometimes the most important thing we can do to take care of our families is to take care of ourselves.
Cancer is a topic most of us do not want to think about. Native women have the worst cancer survival rates. Compared to non-natives, 70% of natives diagnosed are more likely to die. This is likely due to late diagnosis. This is because we wait too long to be screened and treated. We realize that breast and cervical cancer is a taboo topic to discuss, but we have to find a way to prevent and reduce cancer by talking about it.
The best way to prevent cancer is early screening, early treatment, and routine or regular medical care. However, Native women are less likely to be screened and treated early for cancer than non-Native women. Problems identified by Native patients is a lack of access to screening, but also the need for more culturally sensitive and appropriate services.
As Native women, we face many barriers to breast and cervical cancer screening. The biggest barrier is fear. Traditionally, we have come from a history of warrior women. We are women who value bravery, strength, and courage. We must continue to be brave so we can take ownership of our health and take care of our families.
In response to the need for cancer prevention, a group of Native women have come together in partnership with the Susan G. Komen Foundation to share knowledge, consider the risk factors, understand barriers to screening, and explore cultural barriers to cancer prevention within Indian country.
We realize the urgency of ending cancer.
Together,
We can remember our strengths as Native women and as Native communities. Women are the keepers of our Native families. Men can help promote the message of early cancer screening and help prevent breast and cervical cancer. As communities, we can teach our children the importance of cancer prevention.
Together, we can reduce breast and cervical cancer. We can do this for our families, for our children, for our grandchildren, and for future generations.
Be brave, be screened.
Be brave. Be screened.
Be brave, be screened.
Be brave, be screened.